And when you talk about a rights-based approach, it does change the way you look at your work. So, for example, CARE has adopted a rights-based approach, which they say transforms the way they've done things in the past into a much more ethical, respectful relationship between the poor and the rich. Just to go very quickly through the other five, number 2, I think, is compassion and charity. Though one of the efforts is to move away from compassion and charity as the rationale, much more towards the sense of rights. Number 3 is the bottom of the pyramid argument, which you may have heard about, which is future markets. It's in everybody's interests. Number 4 is migration, that if we don't deal with poverty in Africa, it's going to accelerate migration. And number 5 is if we don't do something about it, they'll kill us, which is basically the violence, insecurity, and terrorism. This is obviously a very, very crude, quick, but just to give you some sense of some of the debates. I'm going to come back on the next point, which is aid harmonization, but it is a very important theme in the development world that the numbers of actors, the numbers of projects has reached a point of chaos, and that something needs to be done about it. So aid harmonization is a major theme. Coming more specifically to health, this is true of many other areas, but in health there's a lot of reflection on public and private sector roles. What should governments be doing? What should local governments be doing? What should multilateral institutions be doing versus the private sector? Needless to say, a lot of the debates in the United States are reflected at the global level, sometimes directly, sometimes indirectly. We are looking at a very large increase in international aid to health, which I will give you a couple of figures on in a minute. But they are heavily weighted towards what are called vertical programs, focused on specific diseases. So the HIV/AIDS has had a huge impact, both in changing attitudes, but also in getting money loose. However, the international aid flows are still very unpredictable, and they are insufficient. And it's very unclear what's happening in the long term. In fact, there's something approaching a crisis right now in HIV/AIDS because many, many people have been started on ARV therapy with the verbal promise that they would stay on it for life and that basically ARV therapy would be made available to everyone. But the money isn't there right now. So the question is how this is going to play out. I think we all can be hopeful that in the end the money will come. But there are places already where there are people who are on therapy who are being taken off because the money isn't there. And it's a very worrying situation. There's very wide variation among countries. So Zambia has $20 per capita. Chad has 1.6. A tremendous range. A lot of it not necessarily easy to explain in any logical terms. So my discussion about where religion comes in, which is my current brief, fits in this context. Oh, okay. This is just a chart that shows you the increase in trends in spending on health, so that we're close to $9 billion now coming. This is the bilateral assistance coming, the moving average. And this shows you where the money is going. So the huge hump here is HIV/AIDS. And this is TB, malaria. And only 18% is going into general health. So this is a major subject of discussion. And in fact, when you look at maternal health, that's one of the explanations, that maternal health depends on the development of basic health services. Also depends on attitudes. But as long as the money is going into HIV/AIDS programs, it's not necessarily building sustainable health services. Another interesting fact about this is that a very large percentage of this is going into technical services. In other words, expertise and salaries. Much, much less is going into actual services. So these debates spill over into faith and health. the architecture of the Millennium Development Goals. In other words, supposedly this global compact that we're going to end poverty. We promise enough assistance to countries to achieve this. It is a blessing in some sense, and it actually came out of decades of broken promises. In other words, everyone went to conferences, signed pieces of paper, and went away and forgot them. So the effort of the Millennium Development Goals is to try to put those promises in your face all the time. And it's a framework, but it's a framework that's difficult. Among other things, pastors find it very hard to give sermons about it. For example, as they say, or politicians as well. So the Millennium Development Goal is to halve poverty by 2015. So people say, well, what about the other half? It's only primary education. What about secondary? What about university? What about preschool? None of those are covered in the Millennium Development Goals. So some people actually call them the minimum development goals. So partly as a result, it's quite interesting that religious communities came to this quite slowly. They're getting mobilized. There are a lot of actually religious coalitions now. Bono is involved. Lots of effort to mobilize for the Millennium Development Goals. And you can guarantee the closer we get to the year 2015, the more we're going to hear. But it's a framework, it's an architecture, but it's got a lot of problems. The A business, more and more complex, dynamic, lots of pathologies of, patronizing, difficult partnerships, etc. And that has implications for the faith issues, which I'll come to. We're in a culture where everyone wants to talk about results, and they want to talk, are you on message? So that on health you have to have messages and results. It's interesting, I was talking to someone who was working on a project with a faith-inspired organization that was working with a Gates funded program. I won't reveal who, but they were saying that the Gates people are so impatient for results that they can't deal with the ebbs and flows and complexity of what is development on the ground. So I think this business of message and results, it worries people too because of fads. I mean, that's where some of the debate is around HIV/AIDS, that there's this tremendous momentum to do something about HIV/AIDS. But what about everything else? And I was in Cambodia last summer at a hospital which treats the poorest people, and they were saying that USAID had $300,000 for swine flu isolation wards. And that would not be very high on their priority list, but they're building them and using the facilities and the overhead. So the tendency to focus on the issue of the hour to want results is something that seems to worry some of the faith institutions even more than the rest of the development community. There is a serious shift towards accountability and measurement of results. Now, accountability partly means that the money is honestly used, that it's well used. In other words, it's about corruption. It's also about something else that's very important, which is being accountable to the people you serve, which is something that has really taken on a life within the development community, but one which is still difficult. And as I said, in health, even leaving aside the religion, there are plenty of debates about differential levels of care, about corruption, about whether the government is a reliable partner, whether it's a necessary partner. In the religion area, and I'll come back on this, the reproductive health debates, abortion, family planning, women's rights, etc., have had a disproportionate effect on the debates, very, very significant effect on the debates. And then finally, I do want to just recognize that very often the issues that people are arguing about is money. Money and more money. In other words, who gets the money? So all of these are permeated through these discussions, and I'll come back on all of them. This is a chart of one African country of the HIV/AIDS panorama, and it's a simplified version, you realize, of just one country. And from the acronyms, you can't see them very well, but we call it spaghetti. But it basically conveys the message of a situation that's almost out of control, that there are so many hundreds or thousands of projects and actors. I was amazed to learn recently there's a basket development program.
Seems like all the denominations of the church.
But this is all secular. This is the Clinton Foundation Global Fund, etc. This is that's why aid harmonization has become a huge issue. And one of the themes is that it's time for the international community to get a grip, to have some kind of harmonization. There have been meetings and declarations in Paris, Rome, Accra. The 3 ones, does anyone know what the 3 ones are? It's a commitment on HIV/AIDS that there will be one coordinating committee, one monitoring system, and one funding mechanism. So the idea is that you're not going to have every single donor have a separate reporting and monitoring system, a separate coordination mechanism, etc. It isn't fully in place, but that is a symbol of this effort to try to bring everything together. But it's important to recognize, and I won't take a poll here, but we have in a number of places that there is a counter view. And the counter view is that competition is good, that decentralization, let 1,000 flowers bloom, is really better than trying to have the whole thing in some way orchestrated and moving in a direction. When we do straw polls in the development world, it comes out about 80-20. So it's about 80 for get a grip and 20 for let 1,000 flowers bloom. But in any event, one of the trends, which you may or may not be familiar with, is that there's a move away from project funding. In other words, building a specific hospital or having a clinic or even focusing on a region towards what are called swaps, which is not a financial instrument, but it's sector-wide programs. So that's what swaps are. And these global financing mechanisms. And as I said, there are all the debates about public and private, and there's a lot of concern, and underneath it all is focus on the poor. For example, what should they pay? What kinds of insurance can you have? That's the big issue in Ghana these days. So what does religion have to do with this? As I said in the beginning, this is sort of my question that I'm asking. I start with a development issue, tuberculosis, or whatever, and then the question is, what does religion have to do with it? Now, as far as health is concerned, it's worth remembering that health started in religious organizations. Actually, there's one person who, in the Muslim world, said, if I hear once more the musicians who played for the sick in Damascus in the 11th century, I'm going to have to fit. In other words, there are long and deep traditions that have a great deal to do with religion, so it's worth remembering. And in Africa, a lot of most modern healthcare started with the missionary movements. So religion and health were very close together. It's also, though, worth remembering, I talked to one cardinal, and I was trying to see what does the Catholic Church think that it's doing with all these hospitals? Where is it going? His comment was, the hospital is our cathedral. It's a fundamental part, in his view, of the mission of the Christian church, but Muslims would say the same. In other words, it's the healing mission, etc. So that it's not an accident. It's not something that just came about. It's deeply ingrained and fundamental. The fact that so much of the missionary work took place during the colonial period has left an important legacy. And the post-colonial period in many countries in Africa has led to a lot of tumult. There are several countries where the entire health apparatus was nationalized, then denationalized, then nationalized again. And much of it is in a situation which I would describe as a hybrid. Every single country is different. Every country has its history, whether it's Ghana, Kenya, Mozambique, Angola. At the moment, the Democratic Republic of Congo, I think 90% of healthcare is managed by religious organizations right now. So that it's, but every country is different. So I think that that's an important thing to remember. And of course, we're all worried, very worried, and I'll come back a little bit on this, about the situations of conflict. The DRC, the Horn of Africa, and in a sense, the question, what do religious organizations have to offer and how are they involved, is important. So in this global health challenge, the one reason why we're focusing on religion is because we hope it will help us in dealing with these challenges of poverty. In talking about the faith and the health, there are several hypotheses and several questions that come up constantly. The first one is the data is absolutely appalling. And there are wildly different estimates. The estimate that's come out from the WHO is a range from 30 to 70% of African health care is provided by religious organizations. 30 to 70% is a very wide range. And then there are other things that suggest that it may be more in some places, some that suggest that it may be 10%. So the question is, what are we actually talking about? There are all kinds of speculation as to why the numbers are so widely different. Partly people aren't counting, they aren't labeling. Huge variety. We know almost nothing about what the explosion of Pentecostal churches are really doing on the health side. We know they're doing something, but we don't know where it's going. So that just the question of how big it is. Now, how big it is not necessarily terribly important, because you can say if it's big, you ought to be thinking about it and doing something about it. But the wide range of estimates is very worrying for anyone who's trying to go beyond the surface. A second hypothesis that you hear a lot is that the faith-run healthcare is better quality. And of course, then you get to the point that there's no evaluation, or virtually no evaluation, so no one knows. Now, there is one criterion, which to me is not unimportant, which is every time I've been sick in Africa, which is a fair number of times, somebody takes me to the faith-run hospital. You go to the Adventist hospital or to the Catholic mission or whatever. So we know that there's high-quality health care, but it's not evaluated, it's not assessed. So this question of quality is a big question mark. Another hypothesis is that the faith-run hospitals reach the poor better than government facilities, or certainly better than sort of for-profit. And again, true or false, we don't know the answer. And then there's another hypothesis that we hear quite often, which is that the international funding systems are biased against religious organizations, and that they're not getting their fair share. That comes back to the money issue. So, for example, the Global Fund, which is the major source of funding for HIV, AIDS, malaria, and TB, there's one estimate that only 5% of the money is going to organizations that could be called faith-linked. And if it's 40%, which is one of the estimates of what percentage, that suggests that there's a bias. And then there's the issue of the diversity of these health facilities that are run by thousands, literally tens of thousands of different organizations. There are various interesting initiatives that are trying to address some of these questions. Our HAP is called the African Religious Health Assets Program. It's a very interesting program run out of the University of Cape Town. It's linked to the Carter Center, Emory University, and Gary Gunderson, who works with the Methodist Hospital in Tennessee, is very, so it's a sort of virtual network. And they have done mapping. They've done very intensive work in Zambia and Lesotho, and less intensive in a couple of other countries. In fact, I think that's where the 30 to 70% number comes from, is from there. What's interesting about their work, which is both good and confusing, is that they are focusing quite a bit on religious health assets, which means they're looking at the community, and they're even looking at spiritual health. They're looking at the ways in which communities think about health, the way that they deal with them. So it's a very interesting avenue, but it doesn't necessarily help you if you're trying to measure beds and nurses. So that's the WHO has an initiative that they call Decent Care, that's very much inspired by something from the ILO, the International Labor Organization on Decent Work. And it is trying to sort of set standards with a humane dimension that has a link with a number of religious organizations. And they are also wrestling with this data problem. Yes?
You mentioned the spirituality aspect and the possibility until this question Jason that a lot of us are familiar with the definition of health by the World Health Organization. Some of us have critiqued it in the past because it just covers everything for everyone. Is there a definition of health that governs your work and/or has the definition of health by the World Health Organization been altered to be a little bit more specific and maybe doable?
I think the answer is not really. That is pretty broad. But the WHO is having a meeting in a couple of weeks, which is at least going to try to deal with the data issue and standards. In other words, what are we counting? So they will have to deal, I actually can't go to the meeting, but they will have to deal with the question of how do you deal with community workers who have no formal training? And how do you deal with traditional practitioners? So, I mean, you probably gathered from what I said before that my bias is towards let's at least start with the things we can measure and that you can see, because otherwise we lose ourselves in a very, very broad set of definitions. But it doesn't change when you meet somebody who says that health is really about what people, how they think about their daily lives, you can't argue against that either. In Cambodia, we have 2 people working there this year who are trying to look at everything that has to do with religion and development. So they're talking to hundreds of people and basically trying to, because one of my convictions is that until you can actually see this at a country level, it's very abstract. I don't know how abstract this is to you, but I think it raises questions. But if we can actually see Lesotho, if we can see Ghana, and we can see Cambodia and say this is exactly who's doing what and what the issues are, the policy issues, we think we'll be in a much better place. There are some well-known leaders who have taken up the cause of faith and health. Tony Blair is probably the first one, former Prime Minister of England, who started the Tony Blair Faith Foundation. And the first issue they've adopted is malaria. So they're working on that. There's a philanthropist called Ed Scott, who started a number of organizations, including Bono's group, Data, and others. And he started something called the Center for Interfaith Action on Global Poverty. And the Interfaith Youth Corps, Ibu Patel, who's based here in Chicago, is also picking up the malaria issue. On HIV/AIDS, there's a very long and complicated history of religion and development organizations that started in a very contentious way. HIV/AIDS is the simplest issue where you can say that religion is part of the problem and part of the solution. Part of the problem contributing to stigma, for a start, when pastors refused to bury people in the churchyards, when they spoke out against anyone who had HIV/AIDS, they deserved it. They weren't alone, but they certainly did not do much to diminish stigma, and that's still an issue. And of course, all the controversies around condoms and the position of the Catholic Church on birth control and so forth is a major issue. So it's a very cantankerous debate. And you have many who say that the only way to deal with HIV/AIDS is ABC, abstinence, be faithful. If you do what we told you all along, there won't be a problem. And condoms only in the least of the last case. But I do want to tell the story. I don't know whether any of you have come across the community of Sant'Egidio. It's a very interesting lay Catholic movement that started in Rome. It's my generation. A 1968 group of kids working in the poor areas of Rome. They spread, they're now in 80 countries. They're a lay community, but they worked with the very poorest people. They work in prisons. They're absolutely admirable. They work with street kids, gangs, you name it. They're very much involved with a philosophy of caring and friendship. As a result, it's a fascinating history. They've become involved in almost every conflict situation. and they are well known as among the leading conflict mediators in the world. They've been nominated for the Nobel Peace Prize, got many, many prizes for work they did. For example, in Mozambique, they actually brokered the peace agreement in Mozambique, and Burundi, Cote d'Ivoire, you name it, they're all over the place. But after they negotiated the peace in Mozambique, they saw that HIV/AIDS was the next challenge. And they absolutely refused to accept that ARVs were too expensive, or that the knowledge wasn't there, or that Africans couldn't take medication. And so they are the in-your-face advocates for, we will not accept any standard for Africa that's less than what we would get in Rome. And they are leading as researchers, and they have hundreds of thousands of people on ARV therapy, and they will not accept no for an answer. So they are right in HIV/AIDS. So it's a very interesting path that goes from working with immigrants in Rome right through being on the cutting edge of some of the HIV/AIDS. Leonardo Palumbi is the leader of that group. He's an epidemiologist who's published a lot in The Lancet and who's working on pediatric AIDS as well as other issues. But there are many other organizations that are quite similar in the sense that they are the ones caring for the children. They are the advocates. Very interesting set of stories. Two live issues. With the economic crisis, healthcare programs are under threat all over the place, including ones run by religious organizations. What will happen with the rethinking after the crisis? And another horrible acronym is LICUS, which is Low Income Countries Under Stress. Paul Collier has a remarkable book called The Bottom Billion, which is a paradigm changer. But what he's saying basically is, the rest of the world is lots of problems, but what we really need to focus on is the bottom billion, which is somewhere between 25 and 50 countries, many of them in conflict. And the point here is that religion is much more important in those countries, whether as a source of conflict, but also service delivery and potentially a source of peace. This is a quotation from an interview. We're doing interviews with a lot of people to try to understand this question of, if you have a faith inspiration, your Catholic Relief Services, and you build a well, is it any different than if a non-faith institution like CARE builds a well? The simple answer is, of course not. But there are more complex questions that turn around motivation and history of institutions, etc. But this, somebody from ADRA, which is the Adventist Development Agency, which is really quite a remarkable agency, had this comment: the faith picture is far more chaotic and organic than the development industry expects and would like it to be. This is true for all communities and community structures, but perhaps even more so for the faith world. Bureaucracies want order and structure. They also want fast results. Moving faster is likely to be less effective in the long term, seen from the community perspective. It is essential to take into account how communities see realities and their priorities. So this is something that I suspect will resonate with almost anyone who's been in the Peace Corps, as Laura has, or who has worked with communities in Chicago or anywhere else. But it's this complex reality of how you take the notion of communities and translate them into reality. And when you look at communities in Africa, by far the densest and the deepest established community organizations and structures have to do with religion. So the long-term priorities, where are we going? The governance issues are huge: transparency, anti-corruption. The question of the respective roles of public and private is very much on the table. Local government and decentralization is an issue in country after country. And how does that translate into health strategy? How does it translate into how you deal with this multiplicity of actors? And then, in many cases, you have this missing middle between the community and the national and the global. So for religion and health, the givens and challenges, you have clearly this history, and you have the links to behavior, but the religious roles in health are not always accepted and understood. For development specialists, the argument starts, in fact, the one thing that will sometimes persuade people is that you have all these facilities and they can help achieve the objectives. Fairly instrumental. But integration and coordination are huge issues for both the development community and for health. Now I'm going to turn and go briefly through a question as to, it sounds a bit of a no-brainer, doesn't it? That you should study this, understand it better, try to do something about it. It's been extraordinarily difficult. And the road in the World Bank has been very difficult. And we've had a unique experience in sort of why people are hesitant to get involved with religion. We've heard every argument because every executive director coming from 185 countries had a view on religion. So that's a pretty wide sample. So these are sort of some of these. This is the minefields of religion. And they're not an easy match. I think I'm going to skip over this. But the first, I summarize it as 3 Ds. The first is that religion is viewed as divisive. The second, that is viewed as dangerous. The third, it's viewed as defunct. So the divisive is religion causes conflict. They fight each other. The Shia fight the Sunni. The Pentecostals and the Catholics are at each other's throats. The separation of church and state suggests that it's so complicated that you really should just leave it alone. There's a strong sense among many that religions have a different motivation. In fact, one thing you hear is they're not evidence-based. Now, I do think that a doctor in a Catholic hospital is probably pretty evidence-based, but there are views that they are not. There are views that their motivation in running health facilities is to gain converts, not to serve. And of course, that's very contested. All these are contested. I'm just giving you the arguments. So it's too complicated to deal with. The second is that religion is seen as essentially counter to modernization. In other words, that it's for the status quo, it's for patriarchy, it's for hierarchy, it's against women. And of course, the reproductive health rights debates colors that in a dramatic way. So the question is whether the work is grounded in evidence. And then the third is that many people in the development world, in the leadership particularly, are still operating on the assumption that with modernization, religion becomes less important. We're in a world now where there are books and books and books and books that are talking about the resurgence of religion. In other words, the view that what was the Time magazine cover, God is Dead. I think that The Economist has had a cover that says God is back. What is the resurgence? Do people believe differently? But we do know, and the Iranian Revolution, 9/11, certainly have told the international relations community that their assumptions were false and wrong. But you still have many who see religion as a low priority. The secular myth still persists. So these are the 3 Ds. The E is an interesting one for me because I started long ago working on gender issues when they were not popular. And one of the things I noticed about discussions of gender issues, which is still to an extent true, people's voice tone changes, the people who come to meetings change, because gender is something that people are very emotional about. It affects everyone at a very personal level. I actually think gender is more difficult as a change than anything else, race, religion, anything, but other people have different views. But in any event, gender is very, very pervasive and it's very emotional. But I was fascinated to see the same pattern with religion, that very few people approach this question of religion and development objectively. They approach it as, what do I believe? What do I think? Rather than what do the people that I'm working with think. So it's a very emotional issue. And one of the effects of that is that each individual takes a different view. So if someone is working on Cameroon and has tremendous relationships with a set of religious organizations, and then moves on, their successor may very well not pay any attention to them at all. One of the conclusions on gender, one of the things that changed gender was evidence. So the evidence that educating girls resulted, one of my favorite statistics is that educated girls, their children have a larger head size. But the benefits of education of girls are extraordinary across a whole range of different topics. And that persuaded Larry Summers. So Larry Summers became a leading advocate of education for girls. And the point is that on this religion issue, we need the evidence. The evidence is one of the absolutely critical issues. I also want to say, I was giving you the arguments, the 3 Ds and the E, of why the secular organizations tend to dismiss the issue of religion if they can possibly do it, or why they're uneasy. But it's also useful to remember that a lot of religious organizations have a lot of hesitations about the development world, and I have 5 E's and a D. So the D is the same, it's that they're dangerous. But they see the development enterprise as being basically about empire, particularly United States empire, hegemony. So a lot of questions about the motives of the organizations in the West. Neoliberalism, injustice, structural adjustment. I don't know how many of you have heard these terms, but that's sort of the image. Materialism, greed, focus on the material, destruction of cultures. They also worry about the specific effects of development programs, like when people are moved for dams. They worry about the enigmas. They don't understand the development institutions, their language. They're concerned that there's an economic theology and that they're unethical, that they don't think about the ethical implications of what they do. So that's sort of the story. So I'm going to go very quickly because I think I've already talked too much. But basically, we in the Berkley Center and the World Faiths Development Dialogue have, for a variety of reasons, been looking quite specifically at how religion might be more involved in HIV/AIDS, in tuberculosis, in malaria, and in maternal and infant mortality. Those are 4 studies that we've done mainly through interviews, but also through what we call mapping, which means figuring out who's doing what, where, with what resources, and what they think they're concluding from what they're doing. So the malaria is quite interesting. It is the big issue at the moment in the sort of religion and health area. And there's some not very attractive reasons for it. There's no sex except the mosquitoes, so that it's much easier. But there's some interesting reasons for a vertical campaign on malaria. One of them is that it needs a big push. In other words, if you don't deal with malaria in a substantial area, it will come back. So there is an argument for what is quite attractive to some people, which is an almost military campaign. You know, you get the bed nets out there, you spray, and basically you have huge results in a short period of time. So it's a can-do, it's measurable, etc. So it's much easier than HIV/AIDS and some of the other issues. You can have targets and so forth. So it's the flagship for Tony Blair and for the CIFA, the Center for Interfaith Action on Global Poverty, and the global malaria campaign, realizing that the weakest link, the 2 weakest links are the bed net distribution and use, which is a community function, and they see churches as mosques as being hugely important. They also see a major role in attitudes. That there's a lot of fatalism around malaria, that people assume that it's natural for children to die still, and therefore they don't necessarily take the child to the doctor. So the idea that you could use religious leaders, that's a word that I use a bit advisedly, to do something is important. The World Bank challenged the CIFA that there were 2 countries which had 40 to 50% of the malaria in Africa, which are Nigeria and DRC, Democratic Republic of Congo, which are not easy countries to work in, huge countries to work in. And so there is now a major interfaith effort involving the billions of dollars that are going into malaria in Nigeria. And it's led by the Sultan of Sokoto and the Catholic Archbishop John Onaikum, but with an interfaith committee. And it's going to, unfortunately, I'm not sure they're measuring it very well, but it's a very important initiative. And people are exploring what to do about DRC, which is much more difficult. So that's the experience. We did a survey. In fact, I have a report, and you can find it on the Berkley Center website that we did on malaria. It's a very mixed experience when you look at religious organizations. Most religious communities and health systems had really looked at malaria as a normal part of what they did in hospitals. In other words, they didn't have a special focus. And there was an initial effort in Mozambique to mobilize and to train, basically, the religious establishment to deal with it. And that is going reasonably well, though, as with everything else, it's difficult. But there are basically three levels of action. The first is advocacy, and that's the Nets for Life. Churches have campaigns. You know, you can buy a net with and make sure that it'll go somewhere. So the whole advocacy. The second is through the health systems, and the third is the community. Another interesting point on this is that there's quite a bit of focus on interfaith. That's actually the Obama administration's sort of major new thrust in looking at a religion in the Office of Faith-Based Initiatives and Neighborhood Partnerships, is that, and the State Department actually as well, which has a new initiative, and they're trying to bring different religious communities together to work on a common problem, with the idea that that will help to diffuse tension and conflict at all different levels. So the interfaith intervention on malaria is important. The Interfaith Youth Corps, this Chicago-based group, has selected 30 faith fellows who are recent college graduates who have traveled around Africa. They went to Mali, Tanzania, and Zambia, I think, and they are then going back and working with Christian, Jewish, Muslim, etc., to try to raise awareness in communities about malaria. HIV/AIDS, I think I will not go through that, but I can answer that. And then maternal mortality is one that for us, it's a complete no-brainer for religious organizations. In fact, it's astounding that religious leaders have not taken up, to my mind, the cause of maternal mortality and of domestic violence with more force, given the evidence that we have today of how serious those problems are. So we're working on presenting the facts and then seeing if we can find ways to have initiatives there. And the TB we're still working on, but that is also very interesting, actually. It has lots of roots to very negative attitudes in world religions about tuberculosis, not some links with the way leprosy used to be dealt with, and it's also, once again, when you have dots and monitoring in communities, what better source than the religious communities who are there. So the ethical challenges, I think that I will just end briefly with some of the ideas on where we're going forward. As I said, I think we have to bring this to a specific concrete level of countries so that you can look at Cambodia, Lesotho, Haiti, and say this is who's doing what, and these are what the policy issues are. It's about amassing evidence and using it well, but using it with discernment and political antenna, so that people are more aware of what the tensions are about. I think we need to find ways to have better dialogue about the tough issues, even abortion, that we can't accept the current stalemate and the level of anger that there is around the issue, because it's too important to let that continue. But dialogue is not easy. It has to be done, I think, in a very private, often in a very quiet way, as well as at the public level. There's a lot of talk about networks these days, whether it's Facebook or Twitter or all kinds of networks. But there's a huge demand in these faith communities for stronger networks. And so the question is what we can all do about it. There's also helping a lot of these organizations to be part of the global debates and the global forum. I mentioned the interfaith with a question mark because it's not always clear to me that that's easy or practical, but it is the new priority, and so it is something we need to think about. And I'll end with one comment that we had a meeting in July in Accra of faith and development leaders, and one of the comments there was that if you are not at the table, you end up on the menu. And that is very much the perception of a lot of the faith leaders and communities, that they're not there at the government level when the money's divided up. They're not there when the policy on cost recovery is determined. They're not there when the standards for data collection are set. And therefore you have this sort of dispersion of effort and energy going in different directions and not coming together to work for the central purpose. So I'll stop there. If they don't have an understanding of what the damage is and an alternative source of livelihood, that they won't stop doing it. There are, in South Africa, I think there's quite a bit of work to try to bring in some of the traditional healers. And there is more and more recognition that there are real benefits in traditional medicine, in plants and in traditions that often have not been recognized by the missionaries who were there first and by their successors. On the other hand, there are also a lot of really harmful practices. I find some of the stories of what people do with pregnant women absolutely terrifying. You know, sit on them and whatever else it is. So it's a mixed practice. I know actually in Mozambique in this malaria program they're trying to bring some of the traditional healers into the discussion. Yes.
Really enjoyed your talk. My name's Scott, and I'm a surgeon here, and I've had the good fortune of going on about 10 trips overseas, and mostly in religious-based hospitals. And the impact is, palpable and overwhelmingly positive, but what persistently disturbs me is seeing practices on a family unit level or from a sort of doctrinal or institutional level where they're just completely diametrically opposed to the thing that they're trying to eradicate or improve. And a couple of the simple examples, I mean, seeing, an adolescent girl that's having excruciating abdominal pain, every month that's keeping her home from school, a little 5-minute procedure in their genitals would improve it dramatically, but the family won't let them because of their Muslim belief that she'll never get a husband because she's had a procedure there. I just got back a couple days ago from the DRC and was working at a Swedish Pentecostal hospital. And woman after woman that we saw, 10 kids, 15 kids, they can't even afford to send their kids to school. They live in one room. You ask them, and the mortality rate, 1 out of 50 women that are pregnant die during pregnancy. And, I kept hearing this, and then finally through the translator, I kept asking, hopefully in a nice, respectful way, why they kept having kids when it was such a risk to the kids and them. And it was all, God wants us to have more kids, and Jesus wants us to have more kids. And it really disturbs me on an ongoing basis. And it's more a comment, but if you have an insight or...
Well, let me pick up a couple of pieces of that, because of course you're right. That's why I went through my D's and E. And this is not fiction. There are elements of truth as well as there are elements of distortion. Two things. There's an extraordinary. I was mentioning this business of fads in the development community, but one of the things that really went off the radar screen to a degree that I find impossible to understand is family planning. And family planning programs were reduced, etc. There is a study, and we're actually going to be doing it at Georgetown. We're going to do more on this, on family planning. And one of the things that amazed me was that for a lot of health workers in Africa, when somebody says family planning, they think you mean abortion. So the whole contraceptives disappear. And they're interested in family planning. They're interested in contraceptives, and they need. There's a need for care on vocabulary and so forth. So I think that there's a real opening to come back on family planning, which I think would address at least some of the issues, because it has not been high on any of the development agendas for the last 15 years or so. The second thing that we think is a real avenue, and there is some of it happening, is getting into the theological training institutions, and therefore having the place it started is with HIV/AIDS, and there are actually modules and training programs that are in a lot of the theological institutions in East Africa, at least, which are trying to give the pastors enough knowledge so that they are passing on facts and not myths. And the idea of extending that to maternal mortality, to me, that's an absolute obvious one, and to malaria, tuberculosis, and some of the other diseases, is something that could be really useful and could really make a difference. The broader issue of attitudes, there are a lot. Somebody has described the religious transformation of Africa in the 20th century as the largest social movement or the largest social phenomenon in the 20th century. Now, I don't know if that's an exaggeration. What?
It's not.
It's not. It's huge, absolutely huge. The transformation, the growth of Pentecostals, and it's one of these things that's been almost completely overlooked by the development community. And it means there are these mega churches, and some of them are fantastic and wonderful, and saintly people who are doing extraordinary work, and some of it is scary as hell. And it is, theology, prosperity, money, witchcraft, exorcism, you name it. But you're dealing with a hugely diverse field. And when you've got that kind of diversity, first of all, you've got to know what you're dealing with, I think. And secondly, you've got to sort of have a strategy that deals with different parts of it. So you're absolutely right, and we're as frustrated as you are. But the other comment that I would make is that I have seen attitudes change. There's a wonderful person that we work with who's a Ugandan priest, an Anglican priest with AIDS, Gideon Byamugisha. And he is the most effective spokesperson for AIDS that I have ever seen. And when he speaks to groups, people come out and say, I had never thought of that. I had never seen it that way. And it's because he's a priest, and because he's prepared to talk with humanity and humor, and to put the ethical choices. He sort of puts, if I drink poisoned water and I die, what's the motivation? He really works it through. And so then he talks about condoms and, that the condom itself is not. So he's absolutely remarkable. So maybe that's a third avenue.
I agree. Terrific talk. You talked about this. One of the key questions is how centralized this should be versus letting 1,000 flowers in. It strikes me that one of the benefits of letting 1,000 flowers in is you don't have people to go to read on what humankind's end is and how to order all of these priorities to decide if this is something good to do. And that leads me to this question. To what extent do you think the development community considers or is in dialogue with the traditions within the religious communities about development? So I'm thinking about something like Catholic social doctrine, and which has a lot to say with how you deliver and structure and the idea of how centralized things should be and where accountability should be. Is that part of the conversation at any level?
Well, the two communities obviously overlap.
Yeah.
So you have many people who come to work on development with a strong religious faith. And you have many people who work in World Vision or Catholic Relief Services or Islamic Relief who come because they care deeply about social justice issues at many levels. people are complicated animals, so they have all different kinds of motivation. I would say that the systematic appreciation of the religious world by the development institutions is way below where it should be. And people don't know where to start. Now, we've made a couple of proposals from the Georgetown group of, let's at least do a one-day course. But seasoned professionals are not very big on one-on-one courses. And it has to be very well tailored to what they need. But more, I think the development institutions are opening up. That's the sort of good side. They're hearing civil society critiques, and some of them close off. I mean, one of my favorite comments from someone who was dealing a few years ago with a World Development Report on environment was, well, we're getting a lot of criticisms from the left and a lot from the right, so that we must be in roughly the right place, which seems to me sort of an ultimate cop-out. So apart from the fact that anyone who works on development, anyone who has worked on DRC, or anyone, well, the one really marking event was anyone who had to do with Rwanda or with Cambodia. How did this happen? What does it mean? Where were we? How could this possibly have happened? What does it mean about human nature? What does it mean about what we're trying to achieve? What did we miss? I think that there's a tremendous amount of reflection that goes on. Whether or not the kinds of, these interviews, we have about 80 interviews on the web, on the Berkley Center website, which are these discussions with people about, why are you in World Vision? Why are you in ADRA? We have the Seventh Day, the Mormons, Islamic Relief, a whole set of different organizations. So what is it that motivates you? I really think that kind of a conversation broadened beyond this sort of faith into a more ethical dimension would bring out better what the questions and choices are. So I think there's a lot of openness, there's a lot of reflection. It's not as systematic as it could be.
Could you say a few more words about a topic you alluded to, but didn't speak about in depth, and that was the gender problem in Africa. My son, who spent 4 years in Benin, always felt that was the fundamental problem underlying a lot of the health and social issues that the continent faced. Could you just say a bit more about it?
Okay. Well, let me start with a positive thing, which is that one thing you do not have to anything like the same degree in Africa is the missing girls. In other words, you do not have the huge bias for male offspring and systematic aborting of female fetuses and infanticide, and even not taking the girl to the doctor when you would take the boy to the doctor because who's more important, etc. So that is I think something that should be highlighted because it's very different from a lot of the subcontinent and Asia. And you also have huge diversity in cultures. So you have some societies in Africa that I've been involved in. I think Nigeria is among these, where you have extremely powerful women and who have not only personal power, but also who, through the traditional structures, have. Somebody was mentioning the other day that right across the Sahel, the men own the land, but the women own the trees. And therefore, when you're looking at woodlots and trying to looking at climate change interventions, if you understand that, you can do quite a lot. That said, there's some the biases that there still are and the doubts about that see women as inferior beings or as property is a very persistent set of attitudes. We know that this report that came out last week in this country, there's still plenty of biases and difficulties in this country, but they're nothing compared with it. We're working, this is not sub-Saharan Africa, but in Morocco. Next week, the largest humanitarian prize is the Opus Prize, which is $1 million. for someone who's working on humanitarian work. And one of the 3 finalists is a Moroccan woman called Aisha Chena. And she has been working with unmarried mothers, unmarried girls who have babies. I was translating one of her books, which is sort of 24 vignettes, and just the horrors of what these girls experience. They're sold as maids, basically, where it's as close to slavery as you can get. They're abused with needles and with fire and beatings, and then they're raped, and then when they're pregnant, they're thrown out of the house. Their families won't ever recognize them again. They can't get papers for the baby. In orphanages, 50% of the children die in the state orphanages. This is in North Africa. But you have the fact that young adolescent girls are the weakest, are the least favored group in any society, and the tragic choices that they face. And we're seeing it with the feminization of HIV/AIDS. Now, what people talk about is empowerment of women. But what does that mean? How do you empower women without changing, without education, without changing the attitudes? And this is where we really want to see everyone who can put the facts before religious leaders and communities, among others, and try to bring an appreciation of that the human rights, the equality, which everyone professes, at least in the political classes, that it's translated into reality.
One final question. From your World Bank experience and travel, and the Cambodia example that you gave, I think there's a lot of aid that is just wasted. Is there, from your experience, something that can be done to actually get some of these resources to where they can have meaningful impact on the life of the people that have been so marginalized? The church, like you said, is a global empire if you look at some of these churches, but if you look at it from the people perspective, sometimes it's a different kind of slavery, as I see it, mental slavery, where people can't go to church. You've got to go to the pastor before you've got to, get everything through the pastor before you make decisions about issues that are pertinent to people's life. While the churches, the leaders, they live large, so.
Well, there are two different issues.
I know.
Let's try to
put them together. Yeah.
Okay. The first, I'm pretty optimistic that, first of all, most development assistance does good. That's my view from what I've seen, and I think it's getting better. And has anyone seen the Hans Rosling TED videos? I strongly recommend them if you haven't seen them. He's a Swedish public health specialist. And the good thing about these 2 TED videos is that they leave you with a sense of real progress in key indicators and a speeding pace of change. Plus, he's a genius communicator. So there's something, I can send the link to them. But I think that there is a lot of improvement, and all this stuff I was talking about of swaps and results orientation and accountability is really important. One of the really important things that's happening is much more effort to have community-driven development programs, and they're billions of dollars. You still need to develop the institutions, and that's the catch. The institution building is really tough, whether it's the Ministry of Health or whatever. But the community, the effort to deal with the frustration you were talking about. But there's all this money, but then when you go down to the village, people say, I've never seen it. So there's a lot, people are very aware of that, and there's a real effort to design programs that will do that. There's the conditional cash transfer programs. They're very popular now. I don't know if you've seen or heard of those. They're the programs where you basically give money to the mother, as long as the kids go to school and as long as they go to the health clinic for checkups. And it started in Mexico and Brazil, but it's spreading to a lot of different places, including Africa, Turkey, and New York City. No, they're trying to see if they can use it in New York City. On the church hierarchies, the only comment I can make is that it's diverse as can be. And there are some absolutely wonderful pastors who I would trust my life with. And there are others who I wouldn't. So, I don't know.
Yeah, just one. He asked one of my questions, which is how you were going to engage the community. Yeah, but first, thank you for your lecture. I'm still trying to digest everything. And the title is confusing for me when you were talking about religions and healthcare, because it's sort of like religious institution and Western religion institution. Even Muslim, I don't think is considered. So basically, your approach was, what are these institutions? I call the church an institution. It is doing in providing care and how impact. So I still a little bit confused about if there is any imposition of religious practices, which is, I don't know if you were asking that. I mean, if there is any, like, I will help you, you become such a religious. That's my, and from the religious, and from the World Bank, because I'm from a third world country. I don't call it development, but whatever. We know that the World Bank said, I help you with this, but you do these changes. And sometimes they're not the best. So my question is, if there is imposition from the religious institution and from the World Bank for this development?
Conditionality.
Oh, well, I like your word better. I'm sorry. I call it
no, that's what it's called. Conditionality. First of all, on the religious side, there's a pretty clear consensus, which is also in the Geneva Accords, etc., which applies to humanitarian aid after disasters. And in my interviews that I've done, you will hear from person after person the very strong view that Muslim, Christian, Buddhist, Jain, Sikh, that it is immoral to link any condition to someone who's in a crisis situation, to food for faith, as people call it. In other words, but then you get into slight complicated. Well, we have to share the good news, and if someone asks me, I'll answer. But the codes, the international codes, are very clear. Where it gets much more complicated is in the less crisis-driven. In other words, you go into a community and you're working with irrigation and chickens and you're running a school, and most people would agree that it's immoral to have only certain kinds of people come to your school, but that's not universal. So for example, there are church-to-church programs which would work with Baptists, or which would work with, a Baptist church in Nebraska would be helping a Baptist church in Kenya, and they would basically work within the congregation. Just to complicate things further, there are lots. This religious world is bewilderingly complex. But one of the things that we find is that a lot of the development people think in terms of what they call FBOs, faith-based organizations, which is like Catholic Relief Services, World Vision, the Episcopals, the Adventists, etc., the Lutheran World Service, and they are important, but they don't cover everything. And there are some fringe things, like one of the best development agencies in the world is the Aga Khan Development Network. And they don't want to be called religious because even though the Aga Khan is clearly the imam, he is the religious leader. And it's because of the problems with Islam and the unease about Islam. But so you have that world, and then you have this whole structure of congregations, which are not the faith-based organizations, which are not organized that way. And so you need to be looking at those. Now, on conditionality, I think I've addressed as much as I can on the religious side. The development organizations, when I was working for the World Bank, we hold money in trust. It's public funds that are held in trust. And there's some things that I think are no-brainers, that you want to be sure that when you have a procurement of tractors or procurement of bed nets, that it's as honest as it can be. So that's a lot of conditions around accounting and procurement and, you know, good management, good housekeeping, etc. But the other more complicated conditions get into when you're giving Kenya $100 million to reform. I mean, that nobody gave us money just to give money to Kenya so they can do whatever the hell they want. The money is given to the institutions to bring about reforms and to support reforms. And so there's a long debate about what is the best reform. And there's some areas that most people agree on, and some of them, you know, budget deficits or reforming your mismanaged parastatals, and some where there's more disagreement, like openness of trade or privatization. Actually, I'll end with one of my favorite pieces from Kenya. There's a parastatal company. I haven't checked on it recently, but it was called Uplands Bacon. I don't know if you know what a parastatal is, but it's basically something that in most societies would be run by a private company, but it's run by the state because the state took over everything. So there was Uplands Bacon. So I watched Uplands Bacon for years because it was public pork. So, and they kept saying that they were going to privatize it, and as far as the last time I checked, it still wasn't privatized.
Well, this has been totally wonderful. Thank you.